It's National Diabetes Awareness Month, a time to raise information and awareness about the disease that affects millions of adults and children. Like Ty Gipson, he's here to show and share with us how his life has changed because of it. We also have Dr. Archana Sadhu, an endocrinologist with Houston Methodist Hospital, here as well. Welcome to you both. Thanks for being here. Ty, let's start with your journey. You were just a child when you were diagnosed with type 1. Do you remember back then what those symptoms were like, or what was leading up to it, or did your parents discover it?
You know, it was really just we noticed a really just decrease in energy. I mean, my energy levels were just zapped, and just, you know, I was a very energetic young child, played sports, but you could just see, I mean, after those games, I was just completely exhausted, and that's when they noticed something had changed and got me into the doctor.
And so then you started treatment, but you've had a dramatic situation with diabetes. You've had 3 different transplants, but family came to save your life literally every time. Tell us about that journey.
Well, it's been amazing. You know, when I first got diabetes, there was not as many, you know, the new technology wasn't there, right? So I've had diabetes since I was 8, but then when I was 30, I lost use of kidneys. I had a kidney pancreas transplant at 30. And then that lasted for a while. The pancreas lasted for 12 years, which is amazing, right? So I really didn't have a diabetes for 12 years, which was, right, you know, it's hard to explain to people. I did not have diabetes for 12 years. And then at the age, 20 years later, my kidneys failed again, and my beautiful wife was able to donate her kidney.
Incredible.
Yeah.
I mean, what a journey you've had. Not all cases are this dramatic, but this is a disease that has to be closely monitored. How seriously do you want people, first of all, to know the warning signs and then make sure they're keeping those sugars at a normal level?
So the key to this disease is know your risk, and there are classic risk factors that put you at a higher category of risk, and then if you have those risk factors, you should get screened as quickly as possible. Because to prevent at least one type of diabetes, which is the most common, it's type 2, is to know that you're at risk and then start all of these early interventions so you don't progress to type 2 diabetes.
Now, when you talk about the risks, what would those look like? What are those?
Well, genetics and family history is a very important one, so just get to know your family history, who in the family has diabetes. And if you have members in the family with diabetes, you're at higher risk just by genetics. And then there's other risk factors as well. Ethnicity is a big one. Certain ethnicities do have much higher risk of diabetes. Being overweight or obese, and just a sedentary lifestyle. All of these put you at much higher risk for type 2. Not the kind of diabetes that Ty has, which is much more complicated, but the more preventable diabetes.
And Ty, you've made it your life's mission now to make sure people know about this. And what is your biggest message to everybody?
You know, I would say it's such a mean disease, but it's a very controllable disease. I would just say stay in touch with your physicians. Make sure you're controlled diabetes, because you can live a full life and a very happy life.
And we were just showing all those symptoms on there, so I hope everybody was watching out for those warning signs. Treatments have come a long way too, haven't they?
Absolutely, and being an endocrinologist in this decade, it has been so rewarding to give all of our patients so many more effective options. But really the first thing we do is educate and empower the patient, because prevention is really the key here. But for those who progress onto type 2 diabetes, we have great medications now, as well as technology that really can help them live healthier and longer.
All right, well, thank you for taking time from Houston Methodist Hospital. I know you're very busy, and for bringing in your lovely patient who is such a strong man and has come so far. Thank you.
Thank you.
Thank you for having us.
Yes.